Cavities are one of the most common health problems of today, second to the common cold. It wouldn't be surprising if the majority of those listening have at least one cavity. A major problem that people have today is that they are uneducated about what exactly a cavity is, its symptoms, how it is caused, its risk factors, and the various options of treatment available. But why should one care so much about the subject? Anyone who's had a cavity can vouch for how much of a pain it can be. It can be aesthetically aggravating, difficult to chew food, physically painful, and a hassle to treat. Knowing how to have a beautiful, healthy, fully functioning, cavity-free set of teeth to complement one's smile is something everyone can benefit from. Depending on the stages of a cavity's severity, the signs and symptoms vary with respect to the extent of tooth decay. During the beginning stages, there may not be any symptoms, but as decay worsens, signs such as toothache, tooth sensitivity, pain when drinking hot or cold liquids, visible holes in a tooth or teeth, and pus around the site may occur. A small biology and anatomy lesson behind the mouth's interaction with food and bacteria might reinforce one's initiative towards prompt brushing and flossing after every meal. The majority of cavities occur in the molars, where there are more crevices where food can get stuck and attract bacteria, the main precursor to cavities. Bacteria are responsible for forming acids, which mix with saliva to form plaque on the enamel of the teeth, thus deteriorating the outer layer of the tooth. This constitutes the beginning stage of a cavity. The severity of a cavity relies on how deep the deterioration occurs among the subsequent layers, the dentin, pulp, and finally the bone supporting the tooth.
With a greater knowledge of what causes tooth decay, some of the risk factors associated with its development shouldn't be a surprise. The risk factors of getting a cavity come from tooth location usually happening on the back teeth, certain foods and drinks, frequent snacking or sipping, and inadequate and timely brushing. Additional risk factors include not enough fluoride, worn fillings or dental devices, and heartburn. Neglect of acknowledging these risk factors comes with a price, and unfortunately some people finally end up seeking help from their dentist and/or address their poor hygiene habits at a point when it's too late for simple treatment. There are various procedural and drug treatments for cavities. For the earliest stage of tooth damage, fluoride, a mineral that helps teeth repair themselves, is the most practical treatment option. Slightly more severe damage would require a filling, a material that replaces decayed areas of the tooth's enamel and/or dentin once damage becomes permanent. Damage at a higher level of severity would require a crown, a custom-fitted covering that replaces a tooth's entire natural crown. When decay reaches the inner material of the tooth, the pulp, a root canal is highly recommended. In this procedure, the tooth pulp is removed and replaced with a filling. Lastly, some teeth become so severely decayed that they can't be restored. Instead, they must be extracted. If possible, a bridge or a dental implant should be considered to replace the missing tooth. Practicing good oral hygiene is the best way to prevent cavities. Tips on preventing tooth decay include brushing after eating or drinking, flossing on a daily basis, regular dental visits, avoiding frequent snacking and sipping, and eating plenty of tooth-healthy foods such as firm, crunchy fruits and vegetables. So why is it important to keep one's teeth clean? Aesthetically, having a beautiful smile is important in society. The first thing one sees when someone smiles are his or her teeth. Secondly, having proper function of the teeth and gums is important for various tasks performed for chewing food. Thirdly, pain-free teeth and gums are important to the comfort of an individual. Finally, disease prevention is critical for one not to have to deal with the hassle of getting a cavity and receiving treatment. Hopefully, by following the basic guidelines for having a clean mouth, no one will have to see a dentist for a cavity.
Happy brushing!